Hello, let's discuss interior compartment of the thigh. This is the interior compartment of the thigh. Okay. First we will little bit discuss about the dermatome of the thigh. So the thigh is supplied by L1, L2, L3. The upper part of the thigh, the dermatome is L1, and it is supplied by the femoral branch of the genitofemoral nerve. Okay, the middle part of the interior thigh is supplied by the L2 dermatome, and the nerve is lateral and intermediate cutaneous branches of the thigh, while the lower interior thigh is supplied by L3 dermatome, and the nerve is the same as L2, which is lateral and intermediate compartment lateral and intermediate cutaneous branches of the thigh. Okay, so the interior thigh is covered by the superficial fascia, and after that the deep fascia. The superficial fascia has two parts: fatty layer, okay, and the membranous layer. Fatty layer of the superficial fascia has the great saphenous vein. This is the great saphenous vein on the medial side of the thigh. It originates from the dorsal venous arch of the foot. You can see this is the great saphenous vein. Along the great saphenous vein there is saphenous nerve, which is the branch of the femoral nerve. Okay, and it originates here in the upper thigh. Okay, so this is the great saphenous vein in the fatty layer of the superficial fascia. Superficial fascia fatty layer also has the cutaneous nerve and lymph nodes. Okay, the cutaneous nerve are interior cutaneous branches of the femoral nerve. This is the medial cutaneous nerve, and this is the intermediate cutaneous nerve. Okay, it also has branches from the cutaneous branches of the obturator nerve. Okay, the this is the other cutaneous branches. Cutaneous nerve or lateral femoral cutaneous nerve. Okay, and this one is intermediate cutaneous nerve, intermediate femoral cutaneous nerve. So the fatty layer of the superficial fascia has great saphenous vein, cutaneous nerve of the thigh, and lymph nodes, while the deep fascia has this opening. This opening is called saphenous opening. Okay, and saphenous opening is covered by the fascia, which is called cribriform fascia. Okay, so this is the saphenous vein, and the deep fascia of the thigh, the interior thigh, are it is called fascia lata. Okay, fascia lata, and the fascia lata in the lateral part of the thigh, it is thickened, and the thickened fascia lata in the lateral compartment is called the fascia. This is iliotibial tract, which is the lateral thickening of the fascia lata, the deep fascia of the thigh, and it gives attachment to the tensor fascia lata and gluteus maximus muscle. Okay, so this is the interior part of interior fascia of the interior thigh. Okay, this is the saphenous opening in the. This image shows the upper part of the interior thigh, and the upper part of the interior thigh has femoral triangle. Okay, so this is the femoral triangle. It is bounded superiorly by inguinal ligament. This is inguinal ligament, laterally by sartorius muscle. This muscle is sartorius muscle, and medially it is bounded by adductor longus muscle. Okay, so this is femoral triangle, and the femoral triangle has contents like the femoral vein. This is the femoral vein. Okay, this is the femoral artery, and this is the femoral nerve. Okay, this vein is superficial vein, great saphenous vein, which comes to the or will drain into the femoral vein, and it passes or it travels through the saphenous opening. Okay, so this is the femoral triangle. Okay, the femoral vessels, which are femoral artery and femoral vein, it is covered by fascia, which is called femoral sheath. Okay, it is covered by femoral sheath, and it has two compartments. One is for femoral artery, and other is for the medial compartment is for femoral vein. Medial to the femoral vein in the femoral sheath, there is a canal called the femoral canal. Its superior part is called femoral ring. Okay, so femoral ring and femoral canal is medial to the femoral vein, and it is bounded interiorly by the inguinal ligament. Okay, medially by the lacunar ligament, and posteriorly by the pectineal ligament. Okay, so and the contents of this femoral canal is ligament lymph nodes. Okay, so the deep inguinal lymph nodes are present in this femoral canal. And what is its advantage? Its advantage is that it allows the femoral vein to expand during exercise. Okay, while its disadvantage is that it is the it is the space through which the femoral hernia can occur. Okay, so this is about the femoral triangle, femoral ring, femoral canal, and femoral sheath, and it is present in the upper thigh. Okay, so this is the interior upper thigh. Okay, this is interior. This discussion is on interior compartment of the thigh, so this is the interior thigh. Now these are the bony attachments of the muscle. The first we will talk about the muscle of the interior thigh. Okay, so the muscle of the interior thigh muscles are called extensors. It is called extensor compartment because it helps in extension of the knee joint. This is knee joint. Okay, and this is the interior thigh muscle of the interior compartment of the thigh. Muscle of the interior compartment of the thigh is divided into quadratus femoris. These are the group of muscle which form the interior muscle of the interior compartment of the thigh. So quadratus femoris has four muscles. Okay, the first muscle, this one you can see it, this is rectus femoris. It originates from the this hip bone. I will show you the origin of the rectus femoris. So the rectus femoris originate from the two head. The one head is originated from the inferior iliac spine, and the other head originates from the impression just above the acetabulum. This is acetabulum. So just above the acetabulum there is impression for the rectus femoris muscle. In this diagram you can also appreciate this rectus femoris is originated from the two head. One is from the inferior iliac spine, and the other is from the impression above the acetabulum. Okay, and it gets inserted on the patella. This is the patella. Okay, rectus femoris, and all the four quadriceps muscle originate on the patella, and from the patella there is patellar ligament. Okay, this is patellar ligament which originates on the tibial tuberosity. Okay, so this is the first is the rectus femoris, then the three vasti muscle. This is vastus medialis. Okay, vastus medialis. This one is vastus lateralis, and deep to rectus femoris. If we cut the rectus femoris muscle, then this muscle is vastus intermedius. Okay, so these are the three vasti muscle, and vasti muscles originates from the shaft of the femur. Okay, this is the, you can see this is vastus intermedius, vastus medialis, and vastus lateralis. So all originate from the shaft of the femur. Okay, so these are the quadriceps femoris muscle. The other muscle which are present in the interior compartment of the thigh is this muscle, which is the long muscle, and it gets originated from this interior superior iliac spine. Okay, this is the origin of the sartorius muscle, interior superior iliac spine. Then it comes medially to attach here on the tibia. Okay, sartorius muscle. So this is the sartorius muscle. The other muscle is this muscle. This is pectineus muscle. It is also present in the interior compartment of the thigh. This is pectineus muscle, and this muscle which is basically the common tendon of the two muscles, psoas muscle and iliacus muscle. This is psoas muscle, and this one is iliacus muscle. So psoas and iliacus muscle combined to form the one common tendon, and it is called iliopsoas muscle. Okay, so this is the interior muscle of the interior compartment of the thigh. You can appreciate this is the femoral triangle which we look before this image. So this is the femoral triangle. It is bounded laterally by sartorius muscle, medially by adductor longus muscle. Okay, adductor medial head of the adductor longus muscle. This is adductor longus muscle, and superiorly it is bounded by inguinal ligament, and the apex is formed by meeting point of the sartorius and adductor longus muscle. Okay, you can see this area, this canal which is called adductor canal. Okay, so there are two regions in the interior compartment. One is femoral triangle and other is adductor canal. It is also bounded or covered by vaso-adductor membrane. Okay, so this is the interior compartment of the thigh. The main nerve which gives innervation to the interior compartment of the thigh is the femoral nerve. So this is the femoral nerve. You can see it is still it is in the pelvis. In the pelvis, it is in between the this muscle, the psoas muscle, and this is iliacus. So it is in between the psoas and iliacus. But when it comes to the femoral triangle, it is lateral to the femoral artery. Okay, this is the femoral artery, and lateral to it is femoral nerve, and it has cutaneous branches, the muscular branches to the quadriceps muscle, sartorius muscle, pectineus. Okay, and the iliacus muscle, while the cutaneous branches are, we already have seen it. The cutaneous branches, these are the interior cutaneous branches of the femoral nerve. Okay, so it has medial cutaneous branch, the intermediate cutaneous branch, and also the saphenous nerve is also the cutaneous branch of the it also gives branches like uh, gives innervation to the thigh and the hip joint. Okay, so the main nerve is this, the okay, so it is all about, this is the, you can see this is the femoral nerve, this one is femoral nerve. It passes behind the or posterior to the inguinal ligament to enter into the anterior thigh or the femoral triangle. Okay, so this is, it is in the pelvis. In the pelvis it is lies between the psoas muscle and iliacus muscle, and you can see the root value of the femoral nerve is L2, L3 and L4. So this is all about the interior compartment of the thigh. Thank you.